We're joined now by Amy Zapata with the Bureau of Family Health. Amy, good morning.
Good morning.
So talk to me a little bit about your agency and how it works with AMCHP.
Sure. I work within the Office of Public Health in Louisiana, and the Bureau of Family Health is actually something we've created over the past few years. We started out as I was hired as the director of the Maternal and Child Health Program, and then had the opportunity to combine with the Family Planning Program to become the Bureau of Family Health, which I thought was really important for not just to become this very long name of maternal and children and women's and et cetera, but really try to recognize the importance of families as a whole. And so we have the Bureau of Family Health as, again, the integration of maternal and child health, family planning, epidemiology, and home visiting, and a lot of services that really encompass the family as a whole and communities.
Well, are there some issues that are specific to Louisiana, or some things that you are seeing that maybe folks in other states are not?
I think that every state has a unique environment that they're working within, with whether the state has chosen to expand healthcare or not expand healthcare, or their different budget constraints, or where they've been over the past few years with the different economic situations. And so I think one of the things that I like in Louisiana very much is that the programs, or the state has really embraced sort of short-term challenges. Say, for example, the Birth Outcomes Initiative is something that the governor and the Department of Health and Hospitals started, that was really to really stay the course with some long-term strategies for family health, or to address birth outcomes, but then also some shorter-term wins. So they really worked to reduce elective deliveries for non-medically necessary deliveries, and other sort of short-term strategies to try to move the needle within improving birth outcomes. And so I think that there has been a pretty good culture of starting to embrace short-term innovative strategies, as well as staying the course with the longer-term infrastructure of health and healthcare.
Are there any things that keep you awake at night? Things that just worry you about what with the future, the next few years?
I think it is really trying to assess what is the role of public health as a healthcare delivery entity, or as trying to assure that healthcare services are available. One of the things keeping me awake, but it's oftentimes keeping me awake because it's exciting, is what we're doing around our reproductive health services. We've had a great partnership with the Louisiana Medicaid program of trying to advance the accessibility and the quality of family planning services across the state, and so we're very excited about what we're doing there. When we just submitted our competitive application for family planning services, it was really not just for us to provide great services, but really to try to increase the access of services overall across the state.
Fantastic. So anything that you can point to right now that you're going to take home from AMCHP and really implement or help things out?
Well, I think it's probably on a slightly different note, but one that we've continued to explore, which is what is the role of public health in addressing equity. And so if health equity is relying on sort of economic equity, what is the role of public health to advance the health of communities and the economic stability of communities and families, which there's a really great plenary speaker this morning addressing that.
Fantastic. Amy, thank you so much for taking some time out for us.
That's great. Thank you so much. I
nice
appreciate it.
Nice talking to you.
You too.